Wow, that was rich. Lots of information there. How do you maintain faith and promote specific public health measures, balancing the idea that faith will get me through this with promoting medicine and science, such as what has happened with COVID 19?
Hmm. Yeah. I don't think that those things are contradictory. I do sometimes believe that sometimes, depending on where we are in our, I'll just call it faith maturity, um, we may ask things of God that He's really, we're waiting on God and He's waiting on us, right? So um, if you jump off, a 5-story building and say, by faith, God, I believe I'm going to survive with no broken bones. Well, I mean, God's already put in place the first faith step, which was this thing called gravity, and He's not going to reverse the rules, the laws of this earth, right? So we're living in several dimensions. We are, sojourners living in these bodies, but also, spiritual. Um, beings as well. And so I think sometimes we just, I don't know, we just have misplaced expectations of God. And so I'm not saying that God cannot do miracles, does not do miracles. We see healing miracles all the time. But as I like to say to my sons, I have three now young adult sons, but when they were teenagers, I would say to them, boy, why you make your guardian angels work so hard? Can you just give them a break? You're doing all these things. They just happen to do all this exorbitant stuff to protect you. And so I think it is absolutely our faith that leads us and holds us responsible for looking at the science, for being informed, for being knowledgeable, right? The Bible talks about being hearers and doers of the word. We also want to be hearers of the science and the things that we're living for in this earth. We are, um, I talk a lot, and I feel a lot of an assignment for me. My faith assignment is in the marketplace, kind of like that Daniel anointing, right? He wasn't sent to the church; he was sent to the leaders and the policymakers. And so many of us, most of us, right? Most of us are not reverends as you are. Most of us have a ministry, a calling, an assignment, and we're working, we're going to a job every day. And so, how do we begin to think about, well, how does my faith inform that? My faith doesn't replace the assignment and the natural laws of this earth, but it also helps me interpret them. And so, we'll be tested. Our faith will be tested a little bit when this vaccine comes out, right? And we legitimately, as people of faith and as people of color, have very legitimate reasons to not trust scientists. But I would say that there's something different between not trusting scientists and not trusting science. So teach yourself, read, find trusted sources. I've been so proud of my colleagues in Flint. With the School of Public Health, they're partnering with the community, building trusted sources for people to learn themselves, right? Don't be a victim and don't be beholden to other people. And so our faith is what I believe drives us to be responsible consumers.